Servus Männer, it's Red Pill Germany again. So today I am filming from Osaka, Japan, but I will show you the city in a little more detail, I hope later. Now, for the time being, I just want to make a brief video about the current situation in Germany concerning our healthcare system. There have been news now towards the end of the year that several of our healthcare providers, we have a lot of these so-called Krankenkassen, that is basically private and also non-private healthcare providers. Not that they're doctors, but it's kind of a health insurance organizations. And they now said that they are running at an extremely alarming deficit they did in 2019. That's as far as they can say right now. And that means, and they already announced that the German workers can get ready for increased payments into the health system for next year 2020. And the way that this normally works for normal German workers is that this money is directly taken out of their paycheck. So they see every month in their pay slip basically how much they had to pay. And this is already a very substantial part of their monthly salary, and there is nothing they can do about it. It is basically just taken out of their paycheck. Only if you have much more income, then you can choose a private health insurance, or if you're a self-employed person. But for the normal average worker, there is not a lot of choice. They take it directly out of your paycheck. All right, so none of the many articles that appear in German newspapers right now, however, talk about the reasons. And of course, it's easy to say that we have an aging population, so there is an increased cost on healthcare, and that is of course not wrong. I know a lot of old people, or well, there are many old people who see another doctor every day. You can say, okay, they worked hard all their lives and now they need healthcare when they're old. But some of them are actually just lonely, or they're bored, and they do that so that they have someone to talk to. Of course, this is not a generalization, but you know the arguments from both sides, I guess, but that's neither here nor there, because we always had old people, and most of these old people actually paid into the system during their lives, so that's fine. What is, however, changed, and what is absolutely new in Germany, what was never here before, that is that all of a sudden, millions of people who never paid into the system, who don't even speak our language, who legally shouldn't even be in the country, do now have access to the healthcare system. And they are seen by doctors on a daily basis. All the hospitals, all the practices, they are full of these people. You see them in the waiting rooms. They are definitely getting treated, because I made a video recently where I said that these people are automatically now in our welfare system. So they get the normal standard German welfare, which is called Hartz IV. And of course, that automatically means that they're also in the healthcare system, and they can just go to a doctor and they will be seen and treated. All right, so let's say we have 2 million of those people and they all see doctors. Yeah, it doesn't surprise me that all of a sudden, oh wonder, we have this deficit. And that means the German workers, the German family, the middle class or the working class family, they have to pay for that. And of course, people who are public servants, for example, they don't pay into this system. No, they have their own healthcare system. It's just the normal workers who normally work in the normal industry, who work in the free market basically. They are the ones who pay the bulk of the cost, and they are the ones who have to bleed next year. So that is just to show you that we are actually hemorrhaging funds, money and resources on all fronts. It's not just one thing, it's many things, and the overall cost of living and the taxes and all these fees and the healthcare costs, all this is skyrocketing because of our current political situation and the fact that our laws are not enforced and we do not have borders. Yeah? And this is to tell you what is going on the ground in Germany, and also as a cautionary tale maybe to some of you guys who have elections in your own countries maybe in the coming years, to really tell you what is happening in your countries then, or what will happen. Because yeah, your system might differ here and there, but the bottom line is that you have to somehow provide for these people once they're here. Make no mistake, in a Western country there will never be a situation where you can just get people into your country and then not in some way or another take care of them. Yeah, they need to live somewhere. When they're sick, they must be treated. The moral willpower, or whatever you want to call it, or the moral discipline or whatever, is just not there in our countries to just take them in and then not care for them. Of course they will be provided for, and that means that your indigenous population will have less money, which means less children and less security when you're old, and decreased ability to form families in the first place and to be provided for when you are old and when you cannot work anymore and when you need some help. All right, so I don't want to drag this out any longer and reiterate another time. I think the message is loud and clear, and we see what's happening now in Germany, and every week, every month, every year the picture becomes clearer. All right, take care, servus, Kameraden.